Good afternoon. My name is Aditya. I'm based in Boston, and today I have the pleasure of talking to Dr. Fogo. She's a professor of pathology, microbiology, immunology, medicine, and pediatrics at Vanderbilt University. She's also a director of renal pathology at Vanderbilt University. Welcome, Dr. Fogo. It's a pleasure to have you.
Thank you very much, Aditya. I look forward to speaking with you.
Thank you. How are you doing today?
Oh, wonderful. It's World Kidney Day. I am so grateful for my kidneys, and I hope that everybody who has working kidneys are grateful, and people who need help with their kidneys can get better.
To begin with, please tell us, how did you decide to get into this field?
I was interested in problem solving always, and I knew that medicine was a wonderful way to be able to get new knowledge and to solve problems and to make things better. And I was inspired by one of the wonderful teachers we had in pathology, Dr. Robert Collins, who was a hematopathologist, that pathology could allow you to really answer questions and understand disease at a very basic mechanistic way. And then we had the amazing occurrence of having Dr. Roscoe Robinson, Dr. Ike Robinson, come to Vanderbilt as vice chancellor, and he recruited leaders for nephrology, Drs. Harry Jacobson for adult nephrology and Dr. Yakuna Chikawa for pediatric nephrology. And they needed somebody who knew pathology to help with experimental studies and to help with that. And I was offered this opportunity when I was chief resident in our department. And they were the most brilliant, wonderful, amazing people. So solving problems, academics, understanding disease, helping people was my motivation. And it was fortuitous and wonderful that my department chair, Dr. Hartman and Dr. Robinson, brought together this opportunity for me to get training in renal pathology, and I loved it. So I've never looked back since then.
What education and training did you need to get into this field?
Well, to be a renal pathologist, you have to go to medical school and get an MD in the US. And then you have to do a residency in pathology. In the US, it would require at least anatomic pathology. Most people do combined residency in anatomic and clinical pathology, which I did. And then ideally, you should be fellowship trained, which is a one-year fellowship. So it is multiple years, and then you continue to learn every day from our patients, their biopsies, and from discussing and interacting in a very dynamic way with nephrologists.
Okay. What are you working on now, and what is the most interesting thing that you find about?
I get to spend my time with the renal biopsy clinical service. I'm on clinical service part of the time. I have colleagues who cover it part of the time also. And every time I look at a patient biopsy, I am thinking and wondering about the mechanisms of what we can understand about the dynamics of the mechanism. So I continue to work with diagnostic renal pathology, with novel ways that we can explore specific diagnoses, categorization, and classification. I'll be speaking about that at the World Congress. In my research, I am particularly interested in mechanisms of progression of chronic kidney disease and the crosstalk between glomeruli and tubules, and how we potentially even could remodel existing disease. And we are very excited to be applying novel techniques to this with mass spectrometry. We are beginning to get into RNA sequencing and RNA single cell sequencing. Spatial transcriptomics is in the work, multiplex immunostaining, and numerous knockout mice with cell-specific modification of specific pathways with corollary studies in vitro, and then taking it back to the clinical setting and see if these pathways that we unravel in our animal models also are mirrored in the human disease, so that we can translate the knowledge from one field to another and back. And of course, teaching. I've just finished teaching the medical students end of December and graded their exams. They did very well, and I teach the residents, the nephrology fellows do rotations in our lab, and I get to teach at different congresses. It's very rewarding to see the interest and the questions that people have related to kidney pathology and nephrology in general.
Yes, and as a trainee, recent trainee myself, I'm sure the trainees are grateful for that. What continues to inspire you in this field?
I continue to be inspired when something happens that makes a difference for people, whether it is teaching them that suddenly the light bulb goes off and they understand something and they think of new ideas, seeing past trainees be successful and brilliant and doing good things, or getting feedback from the clinicians that, oh, that biopsy, we discussed this possibility or that, here's some follow-up, what can we think now? Or this is what we found clinically, or what you were hinting at, we found evidence of this and it makes a difference for treatment. So every day there is something that makes me go, woo-ha. I'm so lucky to be working on things that are gratifying and make me feel it was worth it when I'm very tired at the end of a long day.
Thank you for your work. I would like to make a transition to your talk at WCN'21. So what is the topic that you'll be speaking at WCN?
I will be speaking in the Renal Pathology Pre-Congress course. These are pre-recorded, but we will have a live Q&A session. And my topic is to talk about renal immunopathology, potential and pitfalls. So things that we can do to understand more granular detail about diseases with new approaches for immunopathology, whether it's unmasking secrets by using digestion techniques or staining for novel antigens or detecting specific molecules that are present in the biopsy that can help us with diagnosis. So I have 30 minutes where I will go through some things that I think are interesting and useful to know about, and also some of the pitfalls in interpreting these types of tests that we can apply to the kidney biopsy.
So Dr. Fogo, are there any other things related to renal pathology that you're excited about for the upcoming WCN'21?
Well, I think that Ian Roberts and Vanessa Bijoli have done a fantastic job in putting together the pre-Congress renal pathology course. So there'll be several timely topics that will deal with different technical aspects, diagnosis, different diseases, but very exciting. We have a handful of CPC cases with cases being discussed by clinicians. Will be very dynamic and very exciting. And I think it'll be really, really fun for people to participate in that and see how we can solve difficult diagnostic dilemmas.
That's great. Thank you. Thank you for talking to us.
Thank you very much.
I'm looking forward to your talk, Dr. Fogo. Thank you so much for talking to us. It was such a pleasure talking to you today.
It's my pleasure. And I look forward to seeing all of you at live Q&A sessions at the World Congress of Nephrology and hopefully in person at the next World Congress of Nephrology in Kuala Lumpur.